Yes, good afternoon to everyone. We are going to start our class soon. Hope you are all fine after these Janmashtami holidays. We are going to discuss epidemiology of tuberculosis and control. This is very much important topic as far as community medicine is concerned. Tuberculosis, HIV, diabetes, hypertension, these are most commonly asked questions in your exam. So pay attention well in tuberculosis and repeatedly read this topic. Tuberculosis topic is most important part of your infectious disease epidemiology. So without wasting time, we are starting. So tuberculosis, can you tell me the causative organism of tuberculosis? What is the causative organism of tuberculosis? Yes, anybody? Write down in chat box. What is causative organism of tuberculosis? You may have learned this in pathology as well as in microbiology. What is the name of that bacteria which causes tuberculosis? Write down in chat box. What is the name of bacteria which causes tuberculosis? I'm not getting any yes. Mycobacterium tuberculosis. Path has replied. Many other students have also replied. Amisha, Ethel, Munish, all have replied. Almost all students have replied. Very good. Okay. Mycobacterium tuberculosis is the causative organism. Right. So tuberculosis, it is an infectious disease caused by Mycobacterium tuberculosis, and it is very old disease. And you are very well familiar with this photograph, I hope. Robert Koch. We can also say like that. Robert Koch, who has discovered this bacilli, Mycobacterium tuberculosis, in Germany in 1882. Very old. This discovery was very old. So at that time, tuberculosis was very prevalent. It is also prevalent nowadays also. And so one of the oldest disease of in case of the infectious epidemiology. So you can see this slide picture of the Mycobacterium tuberculosis. You can see pink color or red color. Here it is looks like red color. Actually in my slide it looks like pink color. Acid fast bacilli, rod like bacilli. You can see in the slide like this, right? Identify this bacilli, tuberculosis bacilli, rod shaped bacilli. So they are aerobic, means it requires oxygen for their growth, non-motile, it does not move, and rod-shaped bacteria. Rod means this is rod. This is what rod. Rod-shaped bacteria. Some bacteria, cocci, are this dot shape. This is dot. This is dot, right? So these are rod shape. So all the mycobacteria are rod-shaped bacteria. They are acid and alcohol fast, or you can remember acid fast bacilli, AFB. So whenever a patient of tuberculosis comes to you, any patient, if you suspect tuberculosis from the symptoms like 15 days cough, hemoptysis, that is blood in cough, and weight loss. So if you write down the investigation, you write down like sputum for AFB. Sputum for AFB. AFB is what? Acid fast bacilli. These bacteria are acid fast bacilli. They have slow growth, and that's why we require treatment of tuberculosis for long duration, for 6 months, because they are slowly growing organism. So if the organism are slowly growing, we need to treat, we need to give antibiotic for longer duration of the time. Here in case of the tuberculosis, we need to give antibiotic for 6 month duration. So pulmonary tuberculosis is the most frequent presentation. You know that tuberculosis are mainly of two types: pulmonary tuberculosis and extrapulmonary tuberculosis. So pulmonary is what? Which affects lung, and extrapulmonary is what? Which affect other tissue other than the lung. So still many students are there out of the class. Only 22 I can see online. Ask your colleague to join the class. After Janmashtami holiday, they may have forgotten. Write down in your group also that our class is going on, and a very important topic that is on tuberculosis, which will be useful for lifelong, that is going on. So ask your colleague to join the class immediately. So pulmonary tuberculosis is the disease which affect lung, and extrapulmonary is what? Which affect other tissue. So among them, most common is pulmonary tuberculosis. 85% of the tuberculosis are pulmonary tuberculosis, 85%, and other 15% are extra pulmonary tuberculosis like miliary, skeletal, meningeal, gastrointestinal. It can affect bones also, kidney. Tuberculosis actually it can affect each and every organ of the body except nails and hairs. Again, I repeat, tuberculosis affect each and every organ of the body except hairs and nail. So those who are immigrant from the countries where tuberculosis are common, so here tuberculosis, actually in India, tuberculosis is more common, so this may not apply to that also. In people with impaired immunity, tuberculosis may develop easily. So if the immunity is impaired, one important data I would like to share you that you know that almost 40% of the people in India, 40%, 40% of the people in India, they are always infected with the tuberculosis bacilli. You and me may be also carrying the tuberculosis bacilli, but we did not develop the disease because of our immunity, because of our good nutrition. So in your class, if you are 100 people, 40 of them may be harboring the bacteria, that is Mycobacterium tuberculosis, but all of them do not develop disease because their immunity is strong, because their nutrition is strong, right? So whenever there is impaired immunity, this disease developed in form of the tuberculosis. So why to worry about tuberculosis? Because most people control the initial infection, mounting a cell-mediated immunity, right? That prevent the disease, but can leave a residual population of the viable bacteria. So even though we can have the strong immune response, we may have harboring viable mycobacteria, that is live mycobacteria. And among them, 5 to 10% of the individual become infected, develop clinical disease subsequently. But primary tuberculosis develop within 1 to 2 years after the initial infection. If you have the infection within 1 to 2 years, that maybe we can call as a incubation period. In case of the tuberculosis, incubation period may be years, right? So it may develop into the primary tuberculosis, which affect the lung, right? Particularly in children, and is often associated with the disseminated disease. Disseminated means widespread disease. It is spread all over the body. That is called disseminated disease. Post-primary tuberculosis develop later in the life and can be caused either by reactivation of the bacteria remaining from the initial infection or by failure to control the subsequent infection. So two these things are there in case of the post-primary tuberculosis, either reactivation or failure to control subsequent infection. You know that we have already discussed that bacteria may remain dormant in our lungs. It may remain dormant in our lungs, which may be reactivated later on whenever our immunity impairs or our nutrition status is impaired, right? So reactivation or failure to control the subsequent infection can also lead to the post-primary tuberculosis. So post-primary tuberculosis, predominantly it is a pulmonary disease which affects mainly lung, involving extensive damage to the lungs and efficient aerosol transmission of the bacteria. You can see that bacteria can be transmitted from the person who is here. This person is infected, right? So bacteria is transmitted from the person's, actually, arrow is over here. So if you consider this person as infected, bacteria is transmitted from this person to that, and it is going through the respiratory tract into the lungs, right, to the other person. So those who are here, it is also good photograph to show you that whenever you cough or whenever you sneeze, you exhale a plenty of bacteria, lakhs of bacteria, which can infect the person who is in nearby contact. The risk of disease is highly dependent upon the immune status of the host. And nowadays, people are much more concerned about immunity because of the prevailing COVID disease. And you and me are taking many measures to boost up our immunity, right? So always in case of the infectious disease, our immune status, our immune response, that is a prime concern if we develop the disease or not, right? So the immune status of the host is one of the deciding factor whether the person may develop disease or not. Co-infection with the HIV, whenever the person is having already HIV, you know that HIV, human immunodeficiency virus, here I is important, immunodeficiency. So it causes immunodeficiency, and there is always chance that tuberculosis may develop in persons who is already having HIV infection. HIV markedly increased the incidence of both form of disease, that is primary and secondary form of the disease. Due to combination of the economic decline, breakdown of the health system, insufficient application of the TB control measures, spread of the HIV/AIDS, and emergence of the multi-drug resistance, TB is on rise in many developing and transitional economies. Among them, I may not be agree with some of the factor that economic decline nowadays it is not there. Right? Breakdown of the health system. We cannot say that our health system is strengthening. Actually, our health system is strengthening day by day. Insufficient application of the TB control measures. It is also wrong, right? That was true in case of the previous era, right? Before 20 years, we agreed with all these things, but nowadays health system is strengthening day by day, right? Our health system is strengthening day by day, and because of that, there are more effective control measures, not only in case of the tuberculosis, but on all the systems. Yes, that is true. Spread of HIV/AIDS, okay, that is also controlled after an application of this NSCP4 phase. But this is very much true nowadays. Emergence of the multi-drug resistant tuberculosis. Nowadays, this is the most important problem in control of tuberculosis. Multi-drug resistance. Tuberculosis bacilli develop resistance against already available drug. Right? So that is why these are the reasons why TB was in rise in many developing countries in past 20 years. Between 2000 and 2020, it is estimated that nearly 1 billion people will be infected with the tuberculosis, and 200 million people will become sick. And TB will claim at least 35 million lives. So TB is the most important or most dangerous among the infectious disease who takes lives of many of the persons. So it is the leading killer even before corona, or even in presence of corona. That TB is the leading killer, which it is estimated that every day around 1100 people, if you remember 1000, it will be also okay. Every day around 1000 people in India die because of tuberculosis, right? And 5000 people every day get infected, new infection, 5000 people every day in India because of tuberculosis. TB control is difficult, which is why it is still an important cause of the death, right? Currently, the principal control strategy for TB is contact tracing and DOTS and contact tracing. Still, these are the pillar of the TB control strategy. Nowadays, we can call 99 DOTS. That way, I will explain you later on. The DOTS is, remember DOTS, directly observed treatment strategy. Remember the full form of the DOTS, directly observed treatment strategy, right? We will forget about this old data. We are not going to discuss about old data, right? So DOT, that is directly observed treatment, we can also call like that. Both maximize the cure rate and minimize the risk of encouraging drug-resistant strain of the tuberculosis. So because of the DOTS, it maximizes the cure rate. You have to remember this important point. DOTS is why it can maximize cure rate of the patient. Okay, again, we will not discuss these charts. So how global is tuberculosis? 33% of the world population is already infected with the tuberculosis, right? And 25% of the all available death in economically productive group are because of the TB. Again, I repeat, 25% of the all avoidable death, which can avoid. 25% of them are because of this single disease, tuberculosis. So it is causing the high burden of the death in the world. And 33% of the world population is infected. So majority of them are in India, Asia, and in India. Right? TB morbidity, these are again old data. I will not going to discuss this. So where is the problem? Everywhere, but particularly in developing countries where people are immunocompromised, having HIV positive status and weak nutrition status. So because of these factors, immunocompromised status, HIV positive status, weak nutrition status, and always TB becomes the leading disease in developing country. So strategies for control depend upon the many factors. Level of development, whenever the country or society is developed, both economically, educationally, socially, this type of the infectious disease will be prevailing low, right? If the economy is developed and the incidence and prevalence of each country, that will be under control, right? So who are at the most risk, right? So those who are malnourished, malnutrition, high number of the imprisoned person who are in jail, imprisoned person. Recently you may have read the news that in Rajkot many of the prisoners were found to COVID positive, around 25 or so on. They were found recently 1 or 2 days before COVID positive. So here also in case of the infectious disease, because they are in close contact, they are remaining in the close contact. So if anyone develop the disease, such type of the disease like COVID or like tuberculosis, he may spread disease to many other who are in their close contact. So many persons who are there in prison, they become infected. Overcrowded condition, like in case of the India, like in case of the city, overcrowding because of the urbanization, inadequate ventilation, elderly people, those who are in poverty, they are at risk of the developing tuberculosis. Other risk factors, other persons who are at the risk are migrants who are migrating from one place to another place for earning, for refugees, right? That is not the movie name of the movie, but here refugee means migrants. We can say that traveling from one country to another country, travelers. World travel is increasing annually, and so refugee and forced migrants are also increasing because of the various condition, economic downturn. You may have recently experienced this in because of the lockdown. There was unavailability of the daily wages, and because of that they migrant from Gujarat to their places like UP and Bihar, right? Economic downturn or opportunities elsewhere, more opportunities. So this migration may be because of the increasing opportunity. So people from UP and Bihar are coming to Gujarat because of the increasing opportunity of their wages, because of the opportunity of the work, and so they can carry the infection along with them. Smokers are also at the risk. Smoking more than 20 cigarettes a day also increase the risk of the TB by 2 or 4 times, right? Those with comorbidity, diabetes mellitus is also important risk factor that is growing in importance in developing country, right? So these are risk factor. You can see that these are the social risk factor, right? Social risk factor actually. So see, HIV, tuberculosis, they may be considered as the medical disease with the social importance. So this type of the social cause are more important in case of the tuberculosis. Chronic alcoholic, HIV/AIDS, those who are silicosis, who are working in silica factory. So they may develop the tuberculosis, and this tuberculosis is considered as the silicotuberculosis. Increasing drug resistance. So historically, children under 5 years of age were also at the risk of the tuberculosis. However, the risk has been markedly reduced because of the introduction of the BCG vaccine. So BCG vaccine, does anybody know the full form of the BCG vaccine? Write down in chat box. So meanwhile we will discuss further, but write down the full form of the BCG vaccine in chat box if you know. So BCG vaccine is the main prevention measure for prevention of the tuberculosis. It is given at the birth, right? So till now we have discussed about the important risk factor of tuberculosis. Then some important statistics. Tuberculosis is world's second commonest disease, cause of the death from the infectious disease after HIV/AIDS. Or we can say nowadays, this was somewhat old. It has also overtaken HIV/AIDS. Tuberculosis is considered as the most common cause of the death, particularly in India. Most common cause of the death. I have asked the full form of the BCG. Nobody has replied till now. TB is the world's leading killer among the infectious disease, with one person dying of every 15 seconds across the globe. Every 15 seconds, one person dies because of tuberculosis. See, this data is how it is developed. So suppose some 50,000 persons are dying every year. So this every year it has been divided to every year has 365 days. So in a year, if 50,000 persons are dying, that is in 365 days, 50,000 persons are dying. So how many persons are dying in one day? Then from that figure, how many persons in 1 hour? Then that from figure how many in 1 minute? And from that 1 second. So that data is developed like that, right? There are estimated 89 million new deaths of tuberculosis in 2000, and fewer than were reported. No need to remember this old data, but still you can remember in brief that TB is the leading infectious disease or leading killer among the infectious disease worldwide. Most cases are between 15 to 49 of year of age. That is also true, right? Tuberculosis is world's greatest infectious killer of the women in reproductive age group, right? And leading the cause of the death among people with HIV/AIDS. So in HIV/AIDS, tuberculosis is the most common opportunistic infection. Again, I repeat, tuberculosis is most common opportunistic infection, and so that is also one of the leading killer in case of the HIV/AIDS. So some students have replied correctly. Full form of the BCG, Bacillus calmette urine. Very good. Bacillus calmette urine. Fine. The most populous country of Asia have the largest number of the cases, like India, China, Indonesia, Bangladesh, and Pakistan together account for more than half of the global burden of the disease. So this country is 1, 2, 3, 4, and 5. 5 countries account for the more than half of the global burden of the disease. You may be also currently going through the data of COVID disease, like in case of the worldometer, that India, Brazil, and USA. These 3 countries almost account for almost 60% to 70% of the global burden of the disease in COVID-19. In three countries, India, Brazil, and US. If you consider this, almost 60% of the cases daily occurring in these 3 countries only. Right? Case numbers have declined more or less rapidly in Western and Central Europe, North and South America, and Middle East. So these are all developed countries. So by contrast, there have been striking increase in the number of the Soviet Union, Sub-Saharan Africa. Tuberculosis rates have increased in the former Soviet Union. No need to remember about this. I will also skip this part. Remember only important data which is applicable or which is. So again, you can see in Brazil also there are a high number of the tuberculosis disease. So again, it is there same in case of the COVID. So incidence of the tuberculosis varies with age. In Africa, tuberculosis primarily affect the adolescent, that is 11 to 19 years of the age, and young adults. However, in countries where tuberculosis has gone from high to low incidence, like America, tuberculosis is mainly a disease of older people. Right? In America, it is of older people, while in case of the Africa, it affects young age and adolescent age. No need to go through this data. We will skip about this Africa and country specific things. That was enough about this. We are not going to discuss about Russia and Africa. Only you have to remember important data. So in India, it is the highest TB burden in the country. India is the highest TB burden among the world, right? It accounts for nearly 1/5 of the global burden of the tuberculosis. Every year, approximately 1.8 million people, that is 18 lakh people, develop tuberculosis, among which 0.8 million are new smear positive, that is the incidence. 2 out of every 5 Indian are always infected with tuberculosis bacilli. Every day, about 5,000 people develop disease. Remember this data about India, right? Every day, about 5,000. I also previously told 5,000 people every day they are infected with the disease, and 2% die of tuberculosis every 3 minutes. Every 3 minutes. Every day, 1,000 people die because of tuberculosis. 1,000. And that is true since many years. 0.4 million people die every year. Right? So remember this: 5,000 people every day, new cases of the tuberculosis in India, and 1,000 people, 1,000 people die every day because of tuberculosis. So in terms of the mortality, it may be considered more dangerous than COVID also. Right? Still only 45 students today. Right? Write down your roll number now. I will take attendance later on also, but I will consider these roll numbers. Write down your roll number now. Right? So those who are entering late, I will not consider them in attendance. I am continuing with the discussion, but write down roll number now. In India, TB kills more adult in most reproductive age group, 15 to 54 years, than other infectious disease. We have already discussed that TB is the leading killer. Women in reproductive age group are affected most. 1/3 of the female infertility in India is because of the tuberculosis, right? So one of the important reason of the infertility nowadays, you can see that infertility is also prevailing. So 1/3 of the cause of the infertility in India is because of tuberculosis. And do not leave the class. I will not consider if you leave the class after writing roll number. Drug resistance surveillance in several areas in India has found that 2.4% of the new patients have MDR, that is multi-drug resistant TB. New patient, among them 2.4% have, the 100 patients are there, 100 new patients are there, among them 2.4% patients have multi-drug resistant tuberculosis. Their body, their bacteria are resistant to the available treatment. Right? And increase in HIV prevalence also has the serious threat in TB control in India. So HIV and TB, they are like brothers. Wherever the HIV is there, TB will always grow. Right? So HIV and TB co-infection. In 1994, out of 14 million people HIV positive, 40% had also TB. See this data. Out of 14 million, 40%, almost 40%. So TB is the most common opportunistic infection in HIV. TB is the leading cause of death in HIV positive patient. Weakened immunity increase the risk of tuberculosis, progress into the disease, greater risk of misdiagnosis of the TB in HIV and subsequent adequate treatment. So nowadays what happens that if any person is detected with the HIV positive, then that person has to undergo investigation for tuberculosis also. And same way, the person who is found to be TB positive, that person has to also go through the HIV testing. So TB and HIV testing, this is co-infection, and so both this should be tested in any one disease. HIV infection account for much of the recent increase in global tuberculosis burden. Worldwide, estimated 11% of the new tuberculosis cases in 2000 were infected in HIV, which was varying from 38% to 1%, from sub-Saharan to developed country to Western Pacific. No need to remember this percentage. Rates of HIV infection among patients with tuberculosis have remained below 1% in Bangladesh, China, and Indonesia. So increase in tuberculosis incidence in Africa is strongly associated with the prevalence of the HIV, because in Africa, prevalence of HIV is more. So their tuberculosis is also more. So it is associated, tuberculosis is associated with the HIV infection. We will skip about the other countries. Source of TB information. So from where we can get the TB information that any person has TB. So it is compulsory to notify the TB, like in case of the COVID, in any government or private system, if the TB patient is found, doctor has to compulsorily notify the health system, government health system. Then surveillance, right? Mortality statistics and service activity of the data. Surveillance, like our tuberculosis peripheral staff who are actively finding the case. They are actively carrying out the sputum for AFB for the person who is suffering from more than 15 days cough. So that is the surveillance. Like in case of the OPD also, if any person is suffering from complaint of the more than 15 days cough, compulsorily he is investigated for the sputum for AFP. So from them they are found to be TB positive also. Many of them found to be TB positive also. Then mortality statistics. So every year from the district health system or district level survey or state level survey or national level survey, the statistics are being released, and among them mortality statistics can give the about information about tuberculosis. Then service activity data. So tuberculosis is one of the most important notifiable disease worldwide. Notification is most important source of the data for epidemiology of the tuberculosis and initiation of the contact tracing. Surveillance also include monitoring of the death certificate, contact with the health service used by patient with tuberculosis, chest clinic, out clinic, OPD clinic, hospital admission, or other health facility. From all these clinic as well as hospital, surveillance, through the surveillance, tuberculosis patients can be identified and they can be included in statistics. So all these sources have certain limitation in terms of the accuracy and completeness. In particular, developing country tend to have more basic health services and also poor information. But nowadays, these information sources are also improving, and there are various health programs on the tuberculosis, various NGO who are working in tuberculosis, and because of them, this health services and information sources have also improved much. So in West, decline in tuberculosis mortality due to elimination of the poverty. If we eliminate poverty, if you reduce the number of the persons suffering from poverty, TB mortality also decreases. Improved nutrition, because of the elimination of the poverty, there is always improved nutrition, which will lead to the improved immunity, and because of that, TB mortality decreases. Improved medical care. These are the factors which can improve the TB disease. So how to change TB mortality? You can also answer that. We can change environmental condition. Here, in nutrition has the important role in case of the agent. In environmental factor, if we improve the nutrition of the person, hygiene, socio-political changes through the improvement of the hygiene and nutrition, that is in our hand, right? So we can improve the tuberculosis statistics. Host changes, susceptibility, like HIV/AIDS infection. So avoidance of the HIV/AIDS infection, taking care of the precaution to avoid the HIV/AIDS infection, particularly those who are working, who are a sexual worker, right? Travelers, migrants, socio-demographic. Agent changes, development of the drug-resistant strain of the tuberculosis can decrease. I mean to say, can increase the tuberculosis disease. So MDRTB, that is important part of the tuberculosis, multi-drug resistant tuberculosis. So MDRTB is the TB resistant to 2 or more main line of the anti-TB drug. And MDRTB incidence is increasing worldwide. If the tuberculosis bacilli are resistant to 2 or main anti-tuberculosis drug, then it is considered as the multi-drug resistant tuberculosis. More than 50 million people probably are infected always in tuberculosis. And we have also seen previously that among them, 2.4% are almost multi-drug resistant tuberculosis. In the West, MDR-TB is the most common among the homeless people in urban area, like in New York or London or Paris. Like poor adherence to treatment. As you know that tuberculosis treatment is for almost 6 months. So it is difficult to adhere to the treatment for 6 months. And if patient skip drug in between, or skip 1 or 2 drug, then TB bacilli get the chance of development of the resistance. So this poor adherence to the treatment, it is always one of the factor which lead to the tuberculosis resistance in multi-drug resistant tuberculosis. Poor control and prevention program, incomplete treatment adherence have emerged. It is contributed to the emergence of the multi-drug resistant strain. So this is most important factor: poor adherence, incomplete treatment. This is most important factor which is causing the emergence of the multi-drug resistant tuberculosis. So TB control and prevention. Before going to the TB control and prevention, write down in chat box what are the risk factor of the tuberculosis, to whom there are chances of development of the tuberculosis. Write down in chat box what are the risk factor of tuberculosis. Whatever risk factor we have discussed, many risk factors of tuberculosis. What are the risk factor of tuberculosis? Write down in chat box. Risk factor means presence of this factor will lead to the development of the disease. Who are at the risk of developing disease? Write down in chat box. Yes, I'm getting answer. HIV, person with HIV. Then any other thing? Malnourished. Yes. HIV, diabetes, alcohol, smoking. Very good. Poor immunity, poverty, malnutrition. Okay, very good. I have told one data that how many persons are always infected with the tuberculosis in country? How many percentage of the people are always infected with the tuberculosis? So diabetes is also true as a risk factor. Imprisoned, those who are in imprisoned, malnourished, diabetes, HIV, very good. Okay, second question is how many percentage of the people are always infected with the tuberculosis? How many percentage of the people are always infected with the tuberculosis? This 5,000% you have written, 5,000% every day develop tuberculosis, new cases, right? Not 11. 5,000% always every day. This data is for what? Every day new 5,000% develop disease. I have told you that percentage, how many percentage of the people? Suppose I have given the example of the class. Yes, 40%. Right? 40% of the people in India are always infected with the tuberculosis, but they do not develop disease. This 5,000 is for what? They develop disease. Right? Having infection and to develop disease. These two are different things. Now, if you are having the bacteria, but you do not develop the sign and symptom or pathology of that disease, like in case of the TB, if you harbor the TB bacilli, but you do not develop the TB pathology, and because of that you do not develop the disease, that is different thing, right? So 5,000 is for what? I think you are getting now clear. 5,000 new cases of tuberculosis every day are registered in India, and 40% of the people, suppose in class of 100, 40% may be having the TB bacilli, but they do not, all of them do not develop disease. Okay, 1,000 is for what? One student has written 1,000. 1,000 is for new daily death. That is new daily death. Right? Okay, so we are moving further for TB control and prevention. So main strategy include BCG vaccination, case finding. If you find more and more cases, like in case of the COVID we are doing, and then isolate them, and contact tracing, effective chemotherapy, that is for antibiotic, health education, and chemo prophylaxis. These are all strategies: BCG vaccination, case finding, effective chemotherapy, health education, and chemo prophylaxis. In order to reverse the increasing trend of the TB, effective control and prevention is required in all countries. Right? So, summary of the TB: it is the leading infectious cause of the death. Infection rates and drug resistance rates are increasing. Travel and migration are the key risk factors. Poor, weak, and elderly are most vulnerable. HIV positive people are vulnerable and major threat to the future trend. Right? Still, prevention and control, they are to be discussed, but they are in different slide. I will take 5 to 10 minutes more. Right? So I will end this presentation and start new presentation. So do not leave. That was the summary of tuberculosis of current presentation. Right? So prevention and control of tuberculosis. Hope you can see the new slide. So TB control is, it is what? It is the reduction in incidence and prevalence of disease in community. So it can be asked in your YY also. Control means what? That is the general definition you can remember. That is the reduction in incidence and prevalence of disease in community. So WHO defines TB control as the reduction of the prevalence of the natural infection in age group of 0 to 14 years to 1%. So if you reduce infection to 1% in age group of the 0 to 14 years in your country, then it may be considered as the TB control. So according to WHO, again I repeat, WHO defines TB control as the reduction in the prevalence of natural infection in age group 0 to 14 years to 1%. So there are primary prevention, secondary prevention, and tertiary prevention. So primary prevention is through health promotion and specific protection. Specific protection includes what? Specific BCG vaccine and chemo prophylaxis, right? Giving the drugs to prevent the disease, like in case of corona, hydroxychloroquine among the healthcare worker. So that is chemo prophylaxis. Secondary prevention is what? Early diagnosis and treatment. Treatment is through RNTCP or NTEP. Nowadays, this program is now considered as the RNTCP program has been renamed as NTEP, that is National Tuberculosis Elimination Program, NTEP. In recent regional level task force meeting that was been renamed, right? NTEP. I was one of the attendee of that meeting where this rename of the program RNTCP to NTEP was changed. It was held in Rajasthan. So then tertiary prevention, it includes disability limitation and rehabilitation. So health promotion. So we promote the health by improving our nutrition. That is called health promotion. Exercise, lifestyle modification, behavior changes. These are the example of the health promotion. Nutrition intervention. If you improve the nutrition, right? So that is health promotion, right? Environmental modification. If you may modify environment and make it healthy, that is health promotion. And health education. So environmental modification, nutritional intervention, lifestyle and behavioral changes, health education. These are examples through which health can be promoted, health can be improved, right? BCG vaccine. Remember the full form? Bacillus calmette-guerin. It was produced from Mycobacterium bovis after 230 subculture for 13 years. Aim of the vaccine is to induce benign artificial primary infection. So what we give through vaccination? Infection. It contains this bacteria, right? So it is benign infection. WHO recommends this strain, Danish 1331. It can be asked in your MCQ. Danish 1331 strain for BCG production. Age, it is given as soon as the birth of the child. It can be given immediately after birth within 1 to 2 days, or it can be given up to 1 year also. But as soon as possible after birth, it should be given, right? Protective value, it can be protective up to 20 years, 15 to 20 years with success rate up to 80%. There are two types of the vaccine, liquid vaccine and freeze-dried vaccine. BCG vaccine can be stored even for a year, temperature below minus 10 degrees centigrade, and protected from the exposure to light during the storage. Reconstituted vaccine must be used within 4 hours, not 3 hours, but it should be used within 4 hours. So in field, we have to first of all reconstitute the vaccine. It should be used within 4 hours of the reconstitution. Dosage, usual strength of the vaccine is 0.1 milligram and 1 ml, and such strength of the vaccine, it is 0.05 ml. Just you can remember this. Forget about this strength. 0.05 ml of it is given intradermal. Remember the route of the vaccine, BCG vaccine. Here it is difficult. Intradermal. It is given in skin, not in muscle. It is given parallel to the skin. So this it is somewhat the technique which may demand the skill, right? Just above the insertion of the deltoid. So above the deltoid, it is given intradermal over the left side. And it is also universal that it should be given over the deltoid over the left side, right? Intradermal, producing the wheal approximately 5 millimeter. Again, I repeat, this vaccine should be given as soon as possible after birth, within 1 to 2 days, right? 0.05 ml is the dose. Route is intradermal. So it is given over the left side, left arm, over the left side, just above the insertion of the deltoid muscle. This you can see BCG vaccine, and it is how it is given intradermal. This is the photograph. You can see that there is formation, black formation after BCG vaccination, right? BCG freeze-dried vaccine, it may be available in 10 doses, it may be available in 5 doses, but all of the doses after reconstitution, it should be used within 4 hours. So after the BCG vaccine, such type of the wheal formation phenomenon after the wheal, papule, first of all, papule, you can see papule over here. Papule is the raised lesion. Then nodule, and it will be sallow crusted ulcer. Here it is sallow crusted ulcer, and permanent scar may remain. Even if the scar is not remaining, you may check that some of you may have the scar over the left side. You may check permanent scar over the left side. Write down in chat box if you have the scar. Check over the left side. Check over the left side of your shoulder. Over the left side of the shoulder, and write down in chat box if you have the scar. Some of you may have the scar. All of may not have developed the scar. Right? Complication is local abscess formation, right? Prolonged severe ulceration, Suppurative lymphadeninitis, disseminated BCG vaccination. So you may have received this vaccine immediately after birth, at the time of your birth, right? Write down in chat box if you have the scar of the BCG vaccine. Write down as yes. If you have the scar in chat box. I will not get any answer. Write down in chat box if you have the scar of the BCG vaccine. Contraindication: generalized eczema, infective dermatosis, hypogammaglobulinemia. So if any person is suffering from this eczema or immunodeficiency, most commonly, already having the HIV infection to the child, right? Then leukemia or lymphoma, immunosuppressive treatment in pregnancy, then this child may not be given the BCG vaccine. Chemo prophylaxis, it is the term for preventive treatment. INH, it is the short form for isoniazid. Isoniazid, the drug, anti-TB drug, it is given for 1 year, or INH plus ethambutol, it is for 9 months. It is given to the exposed person, right? To the contacts. So to whom it may be given, that the context of the tuberculosis, particularly child contact, children who are there in household, they may be given the INH prophylaxis. So diagnosis, and from this part we will take next time, diagnosis and treatment part, right? So some of the students have written yes. 1, 2, 3. Many students have written yes. They have the scar, right? So even if you do not have the scar, you don't have to worry. Recent criteria that was developed some years ago by IAP, there it is not necessary that each and every child may develop scar, right? But even if you do not develop scar, you have been given the BCG vaccine, you are protected from the tuberculosis for up to 20 years after taking vaccine for up to 20 years. So even if you have taken the BCG vaccine after 20 years, there are chances that you may develop tuberculosis, right? So we have to boost up our immunity. We have to keep our nutrition status powerful. You have to keep your health promoted, right? These are the ways to prevent tuberculosis. I think that is all for today, right? I have already taken the attendance, so we will leave the class. Okay, see you next time.